kipindi hiki asubuhi ya leo, Mwangaza asubuhi, siku ambayo huwa tunakuwa na mazungumzo ya kiafya na wataalam kutoka katika maeneo tofauti tofauti na vitengo tofauti tofauti. Lakini leo niko na mkurugenzi mkuu wa afya kutoka katika kaunti ya Kiambu ambaye yuko ndani ya nyumba kuweza kutueleza. Tazungumza mengi sana kuhusiana na the state of health katika kaunti hiyo ya Kiambu na some of the initiatives ambazo zishafanywa na hii ambayo imetengwa kufanywa tarehe 30 ambayo itakuwa Ijumaa atatueleza mengi. Let me not introduce because he's going to do it. Lakini na wewe ukiwa pale nyumbani labda unatazama, wewe ni wa Kiambu unatazama, wewe ni wa Nairobi unatazama, haujui uanzie wapi, haujui hafla itakuwaje, itakuwa wapi, what is expected of you, basi karibu sana ndani ya nyumba kwa sababu tutakuwa tunasemezana, tutakuwa tunashirikishana mengi sana. Na kama vile ambavyo huwa tunafanya, huwa tunasema kwamba ukiwa una swali, una himizo, una pendekezo, wewe wasiliana nasi, tuma ujumbe mfupi kwa 22914. Unaweza tufuata kwa mitandao yetu ya kijamii, tuko live kwa Facebook page yetu Mwangaza TV na vile vile kwa YouTube channel yetu Mwangaza TV Kenya. Kwa heshima basi si uniruhusu niweze kualika Daktari Hilary. Karibu sana ndani ya nyumba.
Thank you, Celestine.
Yes, I'm honored to host you today.
Thank you, I'm glad to be here.
Thank you, you're most welcome. Karibu sana to Mwangaza Fraternity. This is Mwangaza Asubuhi. Today is Wednesday, we normally tackle health issues and we are glad that you accepted to be here, to be part of the entire talk, you know, kuelimisha wananchi na create awareness about things that we know and things that we do not know. So before tuingie katika maswala yetu, kwa sababu kuna maswali mengi ambayo tungependa sana tuweze kuzungumzia na create awareness katika areas tofauti. Talk to us about Kiambu, the state of health in Kiambu County.
Yeah, thank you, Celestine.
Yes.
For introduction, I'm Dr. Hilary Kagwa.
Yes.
The County Director Health Kiambu.
Yes.
Let me say Kiambu, I'm in charge of the technical advice in terms of all matters related to health.
Yes.
Let me say with a population of almost 2.9, we have made it our obligation to deliver health care to the nearest place that a person lives.
Yes.
We want to ensure nobody in Kiambu moves more than 5 kilometers to access health care.
Yes.
In terms of our health facilities, we have more than 121 facilities public.
Yes.
We have around another 600 private and another one like 34. So in total, we are almost 1,000 health facilities in Kiambu.
Wow.
We work together with the private, faith-based and public because at the end of the day, we want to deliver efficient, effective and quality healthcare which is affordable to our populace.
All right.
Yes.
And we've had issues in other counties. I don't know whether it's the same in your county, where we've had a challenge of dealing with communicable diseases and what have you. Are there initiatives, this is before we get into are there initiatives that you guys have put in place just to make sure that these are also being curbed?
Let me say, even before COVID-19 came,
yes,
we have leadership and governance structure all the way from the county, the sub-county level, health facility and the community level.
Yes.
There are teams that are called rapid response teams,
yes,
that are involved in day-to-day surveillance of disease activities, promotion of health activities,
yes,
and they are equipped to respond,
yeah,
and to treat and to recover and contain, yeah, any emergency communicable diseases,
yes,
like COVID-19, cholera, mpox,
yes,
and any other. We are always alert for any communicable disease outbreak in terms of all pandemics, and all this is coordinated at the county level.
Okay.
Kiambu County, we are privileged to have what we call a public health emergency operation center that is manned 24/7,
yeah,
responding to emergencies or any outbreaks, and we receive reports on a daily basis on any indication of a slight indication of disease outbreak or any threat to public health.
All right, this is what is setting Kiambu apart from other counties.
Yes, Kiambu will lead, others follow.
Hey. Kiambu guys, we lead, others follow. You hear that? Now, I want us to talk about Epuka Uchafu, the initiative ambayo you guys have organized. It's coming up. What really motivated you people into thinking of coming up with an initiative ya Epuka Uchafu Afya Nyumbani campaign?
Okay, let me say, for Kiambu County, even before this initiative,
yes,
Kiambu County, through our His Excellency, our Governor, Dr.
Yes.
Kimani Wamatangi,
yes,
we have been very intentional in promoting public health and environmental hygiene. So right from when he came into office, we have been having cleanup every Saturday of the month is a cleanup in all the sub-county, all the 13 sub-counties.
It's done by?
It's done by the county staff, and we encourage the public to join us.
Okay.
So even you, Celestine, I invite you.
you.
The last Saturday of,
You have the last Saturday?
I think is coming this Saturday. You are welcome here in
After the campaign on Friday.
yeah, after the campaign on Friday.
Nice.
So we've been doing that as a county.
Yeah.
Now the Ministry of Health through the State Department for Public Health and Professional Standard have come up with an initiative called Epuka Uchafu,
Yes.
Afya Nyumbani.
Yeah.
So it's basically an activation. They have done it in 12 counties. Kiambu County will have our activation launch on Friday as a 13th county.
Yes.
So basically, let me say they're just coming to supplement what we've been doing. We appreciate the support because now they are coming with this program that
Yes.
seeks to promote public health.
Yes.
And it is anchored on 4 pillars.
Okay.
It is anchored on promoting personal hygiene in terms
Yes.
of taking care of yourself and avoiding infections. We are dealing with environmental hygiene and waste management. We have a big challenge in the way we manage waste, both at the community, at the hospital,
Yeah.
and institution level. We want to involve a lot in advocacy, communication, and community engagement. And I think that's why I'm here today, because we want to pass this message to the community. And last but not the least, in one of the pillars, we want to address to increase access to water sanitation, and also talk about the quality of food that we eat,
Yeah.
because as we all say, we are the product of what we eat.
Exactly.
And in that way, we are going to achieve public health. And all in this is to achieve the aspect of preventive and promotive healthcare, because it is affordable to prevent illness than to treat it.
That's true.
Yeah.
Someone is watching us this morning, and maybe he or she is asking, why should I even value? Why should I consider, personal hygiene? Why do I value the public health initiative and what have you? In Kiambu County, why do we need to promote public health?
Let me say, I think we can start by roughly defining public health.
Yes.
Public health is the science and art of protecting and improving the health of the community
Okay.
through various aspects like research, educating the public,
Yes.
and putting in place policies that promote health, and especially with the aspect that I said before of preventing health.
Yes.
So what is important to take your own personal hygiene into place is that you want to avoid you getting sick in the first place. So you'll be more productive, you'll be able to attend to your day-to-day duties, you'll be able to attend to your family, engage in economic activities. Because the moment you get sick or get an illness,
Yeah.
you get time off from your work, there's the increased cost of healthcare that would have gone to other things like food stuff and other economic empowerment. So it is important to take care of our health to avoid getting sick. And it also helps in creating a robust and a resilient health system that is able now to afford to assure healthcare to its people, and also have enough resources as a government to engage in other activities and do other development.
Yeah.
But of course, a healthy population is a healthy nation.
That's
So let's start by protecting our health
Yes.
before we indulge in the other activities. Thank you.
I want us to talk about the preventive diseases, especially at household level. There are times when we've had issues of one household maintaining cleanliness, promoting the health, while the other one doesn't do that. And now we are having the Epuka Uchafu initiative, and we are encouraging our residents to make sure that they are, they are also embracing the entire initiative. So what role will each household play to make sure that it's not just about the Epuka Uchafu, but we are maintaining it beyond the campaign?
As I said, we have put leadership and governance in measure even before this initiative,
Yes.
and we have gone all the way down to the communities with the people we are calling community health promoters.
Yes.
They are our foot soldiers on the ground. Those one community health promoter is supposed to cover at least 500 households on a daily basis.
Wow.
And what they do, they go to that household. They do all aspects of healthcare. Are you pregnant? Are you attending the clinic? Are you?
They do follow-ups.
They do follow up. They have a target of households that they visit. In there we have 484 community health using in Kiambu.
Yes.
We have more than 5,080 community health promoters. They are distributed across the whole county. Every day, this person is tasked to households, and they ensure those things. When they come to your household, are you on medication? Are you taking your medication? Have your child been vaccinated? Is your house clean? What is the source of your water? Because we are putting a great emphasis on water sanitation.
Yeah.
Because of the disease, the waterborne diseases.
Yes.
So they come to their household. They help you even if you are using borehole water. Is it treated well? How you store your water? Do you store it in a safe place? Do you store it well? Other issue, are you vaccinated against cervical cancer? Are your kids having all the doses according to the routine?
Indeed, yes.
So in that way, they go from community to community. And what you have asked about one household conducting the expected and the other not conducting, that's why we have brought everybody on board. During the activation, we have brought in the community health promoters, the church, the boda boda, the matatu, the business people, the market people, so that on even after the launch and what we do every Saturday, this message is sustained on a daily basis. And remember, I said in my second aspect, we are looking at environmental hygiene. So the community health promoters and our public health officer educate the people on how to dispose waste right at the household. And I'm sure you have seen in Kiambu County, we have garbage trucks. We have skips that collect garbage at central places. All this is ensuring right from your household, the way you segregate your waste. There is waste that goes to this bin, there is infectious waste, but in the household, how do you dispose even your household waste in a safe place, not just dumping them outside there? Because when you do that, you promote environmental pollution. Bacteria thrive in such environment. Kids play around with the soil and the water, they get infected. Now we incur the cost of healthcare costs. So it's all community engagement, and we cannot do it this alone. That's why we need everybody on board at a personal level. You at your household, you are empowered to know what sanitation involves, both at a personal level and at a community, and also your entire household.
Nice. I was about to ask you about waste management in Kiambu, and you've actually mentioned the trucks and waste disposal, the strategies that you guys are using to make sure that even at household levels, people fully understand what they need to do and how they are able to dispose of. How different is Kiambu from other counties when it comes to waste management?
Let me say, waste management is a challenge globally. And we as Kiambu, we have made it intentional to address it head on. First of all, we have dump site in Kiambu, Kangoki, and the rest, which we have made sure they are secured in such a way that they are safe even to the community living around them. But let me come back to your question. So for us to do proper waste management, we must start at the source where we generate that waste. For example, I'm a doctor at the hospital, in theater, or in the I'm dressing a wound. The way I dispose those gloves I use, the bandages, the stitches, those are infectious. I must segregate them well. The other things that are not infectious, maybe like the bandages that are not infected, that are not with blood. But there is a way we segregate medical wastes, and then they are properly disposed, either in the incinerator and the other ways of disposal, including even now we have microwaves in Gatondo. We have installed microwaves in Gatondo and Tigoni, who now can dispose the sharps, the needles that we use, because we need to dispose them very well. So we have microwaves that combust them completely in a clean environment without polluting the environment. So apart from the hospital now, as I said, now using our community health services and community engagement, we are coming right to your household during our public barazas, using what I'm telling you, the cleanups. We educate the people in your household. When you are done with those ugali, everything in your household that you generate, put them in proper bins, segregate them well. We have collection days for waste in Kiambu across all sub-counties. Then they are transported to the right disposal site and done. So it is your own responsibility the way you unite at your house, because they can be a source of infection to you and your family. So we empower you, enlighten you how to dispose waste and how to put it properly, and including even medicines. We really discourage people. You see, many people will want to flush down the medicines in the sewer lines or anything. That is contributing to environmental degradation. And
how are they supposed to dispose of?
Yes,
for the sake of that one person who doesn't know.
So in fact, if you have any medicines, first of all, let me say, I need to, because we are vaxxed, we are dealing with a very great looming pandemic called antimicrobial resistance. And it is coming to the way we use medicine badly. But I'll not go into that aspect. In terms of disposal, in case you have a drug that has expired, or you have exhausted the days that you are told to take the medicine, it is not right to take the medicine and throw it into the dustbin, because it will find its way into the environment, it will find the way into water, into soil, into the food that we grow. We consume that food, it has small elements of that drug, so the bacteria in the environment in your body get used to that little amount of drug, and whenever you get sick now and you take the same medicine, it will not be effective. So people should collect all the medicine that are expired and take them to their nearest health facility. Okay. Now we are good because now we have community health promoters coming to your household. Just put them safely when they come around. Just give them to them, they deliver them to the next facility, which is a level 2 or a level 3. As I mentioned, we have made sure nobody walks for more than 5 kilometers in Kiambu County without a health facility near them. That's why we are constructing hospitals across all the 60 wards. With the new hospitals, we are coming up with 26 new level 3 hospitals and 6 new level 4 hospitals to make sure whenever you need, of course, we are talking about preventive and promotive health. But wherever you get sick, you get that healthcare that is top-notch, affordable and equitable. Thank you.
Wow. 22914 Facebook page Mwangaza TV na YouTube channel yetu Mwangaza TV Kenya. Mambo mengi ambayo haukuyajua najua unaenda kuelewa vizuri. Hata mimi mwenyewe I didn't know how well to dispose of the medicines. Wewe ambaye kazi yako unasema hii dawa imesalia, you're flushing it down the toilet. Now you know, because daktari anasema please, that is not the right way to dispose of your medicine. And we are not just talking about you, a resident of Kiambu. We are actually talking to the entire nation, because whenever you fail to take up the initiative ya kutunza usafi, kutunza afya yako, you are not just affecting yourself, you're also affecting the society. And that's why it's very important that all of us take up this initiative and take it as a personal obligation kuhakikisha kwamba tunatunza afya yetu. Daktari, before the initiatives came into being, before Kiambu, you guys made it very intentional kwamba tunataka kushughulikia afya yetu, tunataka kuhakikisha kwamba kama ni takataka zinatupwa vizuri. What was the greatest challenge ambayo Kiambu as a county ilikuwa inapata, and how has the many campaigns and the many initiatives affected and impacted even the economical growth of Kiambu?
Okay, let me say, we made it intentional to pursue the preventive and promotive aspect of health. So we saw, and it came very clearly during the COVID.
Okay.
And you can attest today, since even we taught the kids in that time to wash your hands, keep distance, wear mask wherever you have a nini, when you have a cold. You've seen even the number of people who present to hospital with diarrheal diseases, which most of them come from the contamination in the environment. It has really gone down. And what has that done? The expenditure that household were using on healthcare, on small thing, umekaka mtoto anaharisha, akona joto, those who suck their fingers after touching. So by improving hygiene, and one thing I like, and that's why we have brought on board the early education centers and the directors and in schools. Celestine, if you agree with me, today our kids they still remember the hand washing issues in COVID more than us. So they are our agents on preventing infection prevention through personal hygiene. So let me say what you have asked about economically. By preventing those illnesses that used to occur before because of environmental pollution, personal hygiene, compromise of the same, we've seen great reduction in people presenting with such diseases in hospital. So in terms of the household, they have saved the expenditure they will have saved on healthcare costs. In terms of a healthcare system, we are able now to focus more on other things like having equipment for cancer, building more hospitals, bringing more x-rays with the AI and are portable. At least we are able now to expand our healthcare system to make it more resilient and more prepared for bigger pandemics, and to make sure at least everybody at any one time are able to access top-notch healthcare at all time by saving on cost on diseases that will have avoided in the first place.
That is true. That is true.
It is very evident on that.
All right. Now, do you guys get any support maybe from the government, or it's something done within the county?
Let me say, since the enactment of the devolution of the constitution in 2010, so if you look at article number 4, health is devolved. So, but it's a shared function between the national and the county. So the national level are left with the issue to do with regulation, guidelines and training, and just guidance policy making. But where the rubber meets the road is the counties. That's we are the one in charge of the ambulances, the hospitals, the healthcare at the community level. So let me say we work closely with the national government through the Council of Governors in terms of policies, guidelines. You see, like the way we manage HIV or malaria, it has to be uniform globally through the WHO and also at the national level. So they do the capacity building, they give us the regulation, they regulate the healthcare. Even me, I'm licensed by the national government. But now when it comes to the actual enactment of healthcare, running our health facilities, employment of healthcare workers, does. And also I forgot to mention the national government also to remain with the function of training.
Yes.
So training we is a function of the national government. But the actual day-to-day healthcare delivery to the populace is the function of the counties. So let me say, like in this initiative, we have worked closely with them in terms of the coordination. They are helping us with the activation of the launch in Kiambu County on 30th in Ruiru. But after that, the ball now remains in our court. They are just activating it in Ruiru. But we have 12 other sub-counties. So it is for us now as a county, on top of what we have been doing, because now, they are also coming with the aspect of drug and substance abuse. You'll agree with me, it's a menace across the country and also in Kiambu. So there's there's an aspect of mental health and drug abuse that we have been running as a county. So through this initiative, the national government has come, supported us in partner engagement, activation, leadership and governance, working through the county commissioner's office and the national government administrative officers. But now the actual implementation of the program going forward is the function of the county with our healthcare, with our equipment. We have to put resources aside for that. We have to make sure water and sanitation issues, the equipment and what is needed is in place. So that's the function of the county.
Wow. Thank you so much for that elaborate explanation. Kuna swali hapa anauliza Sele, salimia mgeni wetu sana alafu muulize what is the county doing kusaidia vijana wetu wenye wamezama kwa ulevi, wengine wanatumia mihadarati. We are losing a generation. Is there a campaign for this?
Yes, as I said, thank you. We have a mental health program. And that encompasses drug and substance abuse. If you recall, recently the president decreed drug and substance abuse, especially alcohol, a national menace. In Kiambu County, we have been in that right from the word go. In all our level 4 and level 5 facilities, we have mental health clinics that deal with all aspects of mental health in terms of drug and substance abuse, sex and sexual and gender-based violence. And the same people I'm telling you about community health services, the community health promoters, they have been trained on modules on mental health, SGBV and drug abuse. As a county, we are working closely with the county assembly. We want to establish a drug and rehabilitation center in one of the sub-county hospitals. And we want to do public participation. We are allowed to convert one of the level 4s with a serene environment where people with mental illness, with drug and substance abuse are taken and taken care of. But even before we reach there, in our hospitals, there are people who have been trained on issues to do with the tobacco control, tobacco talks, alcohol intake, and other drugs. Here in Kiamba sub-county, we have a clinic that of people who use opioids, heroin. That is a clinic, it's called a medically assisted therapy clinic, that we are rehabilitating drug addicts of hard drugs like opioid. We have done it in Karuri, that is in Banana. We have done it in Thika. We have done it in Ruiru. We have a satellite in Lusigiti in Kikuyu, and we are also dispensing those it's called methadone too, so that they don't go back to heroin. So let me say we have a robust program for rehabilitating drug addicts, and apart from that, we want to focus more on preventive and promotive aspects. So in our talks, even during the launch, we have a mobile clinic that moves on a daily basis. It does not go to hospitals. It goes to markets and free area and open areas. As much as we are doing vaccination against cervical cancer, other immunization, nutrition services, we are also passing the message of drug abuse and engaging our youths. And we have a program running in Kiambu called interpersonal treatment groups, where at the community we are forming groups of people with challenges. They come like once a week, they talk among themselves. We have a counselor from the county and partners just to empower them financially and socially, and also do a lot of family reconciliation and family relation reconciliation that are broken down due to the menace of drug abuse.
Daktari, how have you been able to manage reach out kwa hawa vijana na kuwafanya wakubali hata kuja katika vile vikao? Because if there's a challenge that most, let me not say counties, but most places face, is you reaching out to these young men or to these guys who are in drugs to just accept, you know, and be in a position to say, I want to receive the help.
Thank you for that. How
different did you do it?
Thank you. We came up with a concept early on, even before 2019, of establishing what we call youth-friendly health centers.
Okay.
You go to Ruiru, there's a youth friendly center where you can come, you play pool, you play darts. There are people to talk to you about your reproductive health, especially even our young girls. This we to do with teenage pregnancies, which is a big problem across the country. To talk about menstrual hygiene. In Karori, where I'm telling you we are rehabilitating those people, we have an empowerment center where we have even given them a garden where they can do economic activity like planting trees and selling them. So this is a social place and a social safe place where we bring them together as a group. Somebody talk to them. They also share their experiences among themselves. And by establishing more and more of those youth-friendly centers that are tailor-made to their needs and their wants, including even the HIV. Our young people who have HIV, we have programs tailor-made to them where we have groups. We empower them even economically. We support them through school and hold their hands even as they go into employment or into business. And at the back of it all, making sure they are adherent to their medication, maintaining a healthy lifestyle, and of course fighting stigma, which now makes them shy away from coming to access healthcare services in an open area. So let me say we have such programs, youth-friendly clinics, activities for them, and at the community level, the CHPs are trained in their what I'm calling the community health units. They have their own units where they form those groups, and especially where the issue of now the drug abuse or the youth unemployment is rampant. We are engaging them. And we are doing it not in isolation with stakeholders. We have to involve the border people, the matatu, the clergy. The church is very important. Every person, the chiefs. So everybody is brought on board so that at the end of the day we own our health as a community. Thank you.
Jen anasema Sele, I'm a proud resident wa Kiambu, lakini nataka daktari atusaidie kuelewa how are we going to help our young children, kwa sababu mambo ya sexual perversion yameinuka sana, especially in Kiambu, and when we are talking about afya yetu, it begins with that one. Tufanyeje?
Thank you. I think I mentioned about, first of all, I hope the one who of us have taken his or her child for vaccination for cervical cancer. It's really working and it's really preventable.
They talk about that because kuna watu ambao they are very skeptical about that, and people do not even know kwamba it is important that you vaccinate your child.
Cervical cancer, it is one of the leading cancers in Kenya, and it's one of the highest. It is leading in killing. It's called its mortality ratio is very high. It kills very fast, and sexually transmitted by a human papilloma virus, strain 16 and 18. The unfortunate thing is that it is killing our women, and yet it is one of the most preventable cancers by vaccinating against the viruses I've talked about, HPV 16 and 18. And studies and research has shown if you vaccinate kids between 10 to 14 years, initially we used to vaccinate them with 2 doses. Now we are doing just 1 dose at 10 years. It has been shown to provide a lifelong protection. On top of that, even women aged from even 35 all the way to 49, let them be screened early, because early detection of cervical cancer saves lives. Because when it is detected at stage 1, it can be, we are even treating them at our Thika Cancer Center. So, and early screening and early treatment, and those who are found to be with cervical cancer, we have equipments in place, we have drugs now, we have personnel trained on oncology that you can treat it. So I think for our children, the other thing she has mentioned is teenage pregnancies. Kiambu County, let me say, it has been a challenge, especially because of urbanization. Kiambu is 60% urban, 40% rural. But you find, especially along the highways, you find from Nairobi, and Kiambu is the bedroom of Nairobi. So you find here next is Ruiru, Juja, Thika. So because of the economic activities and the rural to urban migration, we have been having a challenge of 11, 12 year old, 13 year, basically kids having kids. So it's we have engaged, and now we are doing it at the community level, where we are bringing all these teenage pregnant girls. We are having, sometimes they are facing stigma and rejection from their families. So we have formed support groups to empower them, to tell them if life can still go on, if after you get pregnant, you can. We have programs. We are working closely with the TSC on rehabilitating them back to school. So we put it in place. You make sure you attend your ANC clinics. Your child is vaccinated after 6-7 months, or after you have weaned off the kid. There are programs to assimilate you back to school. And even when you are done with the school, if you are not going back to school, what else can you do? Can you do a course that can empower you? And now that will not work alone. Who are making our girls pregnant? it is our community.
That's true.
So we have to engage them. We have done engagement with boda boda, with the tuk-tuk,
Yes.
with matatu, with the chiefs, just to bring everybody on board and tell these are means we are just jeopardizing the future of our young girls and young children. So we have those programs. And let me say this: nutrition. We are not also doing the well. We are having a slight increase of low birth weight kids and malnutrition, and including the adults. In the recent Kenya Demographic Health Survey, Celestine, 58% of women in Kiambu are obese. Why? Because of taking sweet things, Java, or whatever. I'm not against, but we need to promote healthy lifestyle and nutrition for our kids. Because when you have a low birth weight kid, you affect now the entire life. First of all, they are delayed milestone. That kid may not perform well in school. So you see, it becomes a generation issues. So we are trying to put in place, even right as we taught to these teenage mothers, or we teach them about kitchen gardens, how to feed your baby. Even when you are pregnant, during the ANC visit, are you taking the iron supplements? Are you eating well? Are you vaccinated? Are you getting tetanus? So that at the end of the day, a healthy baby is a healthy population. So we have a robust program of taking care of our kids, right from conception to delivery, immunization as they grow up. Thank you.
Nice one. Even as we are coming to the end of our show, I won't allow you go without telling us how you've incorporated the schools into making sure that the campaign is sustainable. The way we did during the COVID-19, children being taught on how to wash their hands. We've seen vaccinations being carried out in schools. Do we also do this in Kiambu, going to our schools?
I think, let me say, Celestine, this campaign is anchored on what is called One Health approach. One Health involves everybody.
Okay.
Animal health, environmental health, and animal, environment, and human health.
Yes.
On that aspect, we are bringing everybody on board.
Okay.
We have, like in this lounge, we have the director for water services.
Okay.
We have the director for environment. We have the director for early education. We have the director of education. Because we are not just doing, schools are part of our community.
That's true.
And as I said, they are a great champion up to date in terms of code on infection and prevention. Even on the activation lounge, we'll have schools represented there. When we roll it out to the other sub-counties, we'll go to homesteads and schools. Because when we empower kids, they'll take the same message to their homes.
Their parents, yes.
So we'll be killing many birds with one stone by bringing the kids and the education system on board. And of course, even impacting that knowledge in them. It lasts a lifetime in terms of prevention, infection prevention, environmental hygiene, and basically water and sanitation, and the other aspect we'll be talking about here in ensuring public health.
So how are we going to monitor the success of Epuka Uchafu initiative?
Thank you. We have formed a county steering committee that is involved with the activation and the rollout to the other sub-counties. In that aspect, there is a what we call M&D, monitoring and evaluation team, embedded in that steering committee. Their function is, like now we have a baseline study. We can tell you how many diarrheal diseases have come from Githongori, from Lari, from Tika, from Roiro. We have a baseline. We have the statistics. So we have a baseline. Of course, we've been following it with our program of cleanup exercise and everything. Now, with this activation, going forward in healthcare, data is very important. We are making data-informed decision. So, with our baseline, after 1 month, we'll sit down and see we have done activation in Roiro and Lari. So, before the activation, this was the diarrheal cases, these were the people being referred to hospital, this was the how are we going? We have regular meetings as a steering committee with all the stakeholders I mentioned, from water, from health, from environment, from agriculture, because we are also involving the farmers, how they dispose their waste in their farms. So we have the monitoring and evaluation aspect, because that is what now makes us even advocate for more resources to change our tactic if things are not working. So in all aspects of our healthcare, we embed the issue of monitoring and evaluation, and we have that team in place.
Nice one. Where do you see Kiambu County in the next 2 years, especially in the health sector?
Let me say, our mission in Kiambu County is to be the renowned county with the most efficient, effective, affordable, and accessible healthcare. As I mentioned right now as you speak, we want to make sure nobody walks for more than 5 kilometers.
Yes.
When you go to our facilities, the fill rate of drugs should not be less than 95%.
Okay.
When you're written a prescription, at least 95% of the drugs you will get there.
Yeah.
In our healthcare system, we want to prevent people getting sick. We want to promote a healthcare Kiambu people.
Yes.
So that's why we are investing a lot on the community health service.
Yes.
We want to go to the communities, do this. We want to empower our level 2 and 3. Those are the dispensaries and instead of coming to Thika level 5 or Kiambu or Gatondo or the big hospitals, can your issues be sorted at the local level? Are people able to come to your household to see how you are taking your medication? How is your environment? How is your water? How are you preparing your food? So in the next 2 years, we want to see a Kiambu that is resilient, economically empowered by being healthy, saving on healthcare costs, and as us as a healthcare system, we want to have a robust and resilient that is responsive to the needs of the populace in terms of having adequate human resource, having adequate equipment, having adequate human health products and technologies, having the infrastructure in place, the ambulance, and to cap it all, having it an all-hazard public health emergency operation center. We have an emergency center in Thika that is all call center that is manned on 24/7.
Yes.
We want to make it an all-hazard where we work with the traffic police, with wildlife, wherever there is an incident of people like hyenas eating Juja. We are able to respond to that, empower the community. Wherever we have a traffic accident, God forbid, we are able to respond as a multidisciplinary team. We want to empower our blood transfusion satellite center in Thika, and we want to establish another one in Tigoni, so that there is no lack of blood in Kiambu County. There is no drugs. We have enough. Like at the moment, I can tell you, Kiambu, we are very unique in that with doctors, we have more than 450 doctors, majority of them being consultants. So you don't have to go to other facilities outside the county or national level to seek for service, because we have invested in our human resource to treat even cancers, neurosurgery, all even specialized and subspecialties. We have invested in that, all in all, to make Kiambu County a healthy population and an economically vibrant population.
Wow. Thank you so much, Rachel. Unasema very informative. Uko ndani ya nyumba. Great job, our CDH. Thank you so much. Alafu Margaret unasema say hi to Dr. Kagwa. Asante. Unasema in Kiambaa sub-county, Karuri level 4 hospitals, Kawaida level 3 hospital, Ruaka level 3 hospital, Kimani wa Matiangi ametuletea history in making. Say hi to our daktari. Umesalimika sana. Much appreciation to my CDH for great articulation of all public health issues. Thank you so much. Mwingine anasema kwamba Dr. Kagwa, you are explaining well. Alafu unasema in Kiambu County, we are happy. Our governor has improved health sector. Unasema you have modern x-ray machines, new modern ultrasound machine. Alafu James unasema congratulations Daktari Kagwa for articulating public health issues so well. Asante sana. Upande huu mwingine unasema the first one I had responded to that. Mwingine anasema Sele, kwani sisi tuko wapi? Si hata sisi tuwe kama Kiambu County. Uko peke yako. Ambao kuja watembe tutaonesha njia. Uko peke yako. So you have to come. You join us in this campaign on 30th. Ili tuweze kuiba. Let us see what these guys are doing. Tutoke kule na ideas ama ni aje. Let's go that 30th. You said every last Saturday? It's a clean up exercise. A clean up exercise. I think next to your home. I think we need to look for our gear. We come join you. Tukiclean lakini tunaiba tunaangalia what you guys are doing. Even if you don't have gear, we'll provide gear for you for the clean up. Nice. So these are things that we need to do. Alafu Mwalimu Paul unasema Sele, thank you so much. Say hi to Daktari. Ameeleza vizuri sana, and I'm hoping that each and every other county itaweza kuemulate so that our mothers don't die during childbirth and our young girls hawauchi kwenda shule kwa sababu ya early pregnancy. Thank you so much. Endelea kutuma ujumbe wako hapo tunapoendelea kutamatisha kipindi chetu. So Daktari, what message do you have for the households and the institutions ambazo ziko Kiambu County concerning the campaign we are having on Friday?
First of all is to welcome everybody for the activation in Ruiru, and that is just the one of the many, because we are going to go to all, we are going to Lari, Kiambu, Kiambaa, Githunguri. Yes. So I also want to reemphasize that afya letu jukumu letu. Let's own our health at a personal level, at our community level, at our household level, at our community, at institution level. Yes. Are we having enough hand washing points in our schools, in our hotels, in our construction sites, in our household? Are we able to segregate waste well? Are we eating safe food in our own house? Where is the source of our food? How is the water we are taking in our home? Is it safe? Is it contaminated? How do I know? How do we treat it? We are also empowering you. How do I seek health services? You don't have to be very sick. In case you have these symptoms, we have made sure healthcare is very close to you, so you can go for diagnosis. The CHPs I talked about, we have equipped them with equipment. They have blood pressure, they have blood pressure measuring machine, they have blood sugar, they have things to measure the nutritional status of your kids at home. They are equipped. They are also working hospitals. Let me say in a light word. So we empowered healthcare right from your household, so that you don't have to wait until you are very sick to come to our level 4 and level 5. You can be treated right at the comfort of your home. And going forward, we are also pushing for the agenda of self-care, where we want to empower you, Celestine, in your home. Even if you have a chronic illnesses, we empower you to take self-care in terms of tracking your appointment with the doctor, when to go for your medication, what to do in case there is a side effect to your medication, who do you go to in case you are feeling unwell, or you need an ambulance as an emergency. We have ambulances spread across the county. Are you empowered to make those decisions? Are you aware of them? And that's why for communities like you, as an institution, advocacy, communication, and community engagement is our strong pillar to address that.
All right. Epuka uchafu, afya nyumbani, tarehe 30 Friday, ambayo ni Juma hii, Januari, saa 3 asubuhi, we are going to Ruiru Stadium, Ruiru Municipality, Kiambu County, for the campaign. Thank you so much, Daktari, for coming. Thank you so much for the insight. Thank you so much for your time. May God bless you and do you well. Watu wa Kiambu, endeleeni kufanya what you're doing. Actually, you are the pace setters. You've set the pace. Sisi tuko hapo tunawafuata, and we are grateful that at least we have a direction. We are at least getting the insight on what should be done and what should not be done. So thank you so much once again. Mungu akubariki sana na akutende wema.
Thank you. Thank you so
all
much.
The best.
Thank you.
Majaliwa tutapatana Ijumaa.
And welcome to Kiambu.
Thank you. Mtazamaji, nataka tuweze kutambua wadhamini wetu, lakini nitakaporejea pia narejea na daktari ndani ya nyumba. Nataka tuweze kuangalia maswala, kwa sababu maswali mengi ambayo tumekuwa tukipata, ambayo yamefanya nikamwalika daktari, ni kuhusiana na changamoto ambazo watu wengi wanapata haswa wakati wa ujauzito. Changamoto ambazo wenyewe wengi huwa hawajui kwamba ni changamoto, ama wengi wanangoja waone dalili ikiwa kubwa ili waweze kukimbilia daktari when it is actually too late. So I have a doctor in the house. We want to talk about this and fully understand what should we do, what are the signs, what are the danger signs. Na wewe hata kama hauna mimba pale, you can tell a friend to tell a friend, alafu sisi wote tunakomaa, tunagrow, tunakuwa